Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, and welcome to this episode in the AMA Steps Forward podcast series. I'm your host, Dr. Kevin Hopkins, a family medicine physician and senior physician advisor here at the AMA. Caring for people with cancer is complicated. We know cancer affects more than just the person's body. A new cancer diagnosis can turn a person's whole world upside down. It generates fear and anxiety. It affects a person's mind, body, and spirit. Relationships with family and friends are profoundly impacted. Typical treatment for many cancers include medicines and treatments that can have brutal side effects. Sometimes the treatment can be worse than the disease itself. By adopting a whole person, integrative approach to oncology, care teams can better support patients and families on their cancer journey. To help us learn what whole person care in oncology looks like today, I'm joined by Dr. Wayne Jonas. Dr. Jonas is a board-certified practicing family physician, an expert in integrative health and whole person care delivery, and the founder and president of Healing Works Foundation, a not-for-profit organization where the mission is to make whole person integrative care regular and routine. Dr. Jonas is also an adjunct clinical professor of family medicine at Georgetown University School of Medicine and the Uniformed Services University of the Health Sciences. Dr. Jonas, thanks so much for being our guest on the podcast.
Thank you so much, Dr. Hopkins. I appreciate you having me back, especially to focus on the concepts of whole person care in cancer care, which I think really touches probably everybody, professionally and personally, over their lifetime.
It sure does. And some of you may have already noticed, but we've had Dr. Jonas on the podcast before to talk about the principles of whole person care in a more general sense. And if you haven't listened to that episode yet, I highly recommend you check it out. You can find a link to it in this episode's description. But today, we're going to focus our conversation on whole person care in oncology. So, Wayne, the Healing Works Foundation describes whole person care as person-centered, relationship-based care. Can you help me and our listeners understand why a whole person care approach is really so crucial, especially in the field of oncology?
Yes, I will happy to do that. I mean, what we might mean by whole person care really is something that brings the patient into the care, separate from but integrated into the treatment of whatever disease or diagnosis they have. It focuses on the so-called salutogenic or the healing creation approaches, what matters to the person as a person before they're a patient, to help engage them in their own care and to facilitate health and well-being along with the disease treatment. In the area of cancer, this is important for chronic disease, especially. And that's what the previous discussion was. But cancer is special in the sense that it really concentrates all of this into a very highly intense and focused area, because most of the time it just sort of pops out of the blue. People otherwise feel like they were healthy and they thought everything was going along well, or at least they knew what was going on. And then suddenly they get that word and that diagnosis, and the entire cancer industry descends upon them. Their family often and friends descend upon them, want to help out in some way. And so it's like crunches the entire thing into a very a focused area. And it's becoming much more widespread. Not only is it the second leading cause of death in the country, but it's growing in prevalence. 26 million people are estimated by the American Cancer Society to be living with cancer. That is really as a chronic disease by 2040. And so it's going to become more prominent, more important.
Yeah, a couple of key points that I just heard, and I've thought of this a few times too, that really cancer is becoming a chronic disease for a lot of people. It wasn't all that long ago that cancer of any sort was often considered a death sentence. And while sometimes that may be the case, that it does lead to that, eventually that can be years or even decades down the road. So there may be more people living with cancer each year than maybe dying from cancer.
Now, that's absolutely right, and we should think of it that way. But when it comes on us, we often sort of put aside that concept of how do I live well with this over long periods of time, with the false idea that if I simply get rid of the growing cells, then that will solve the whole problem. And we'll talk a little bit about why we now know from science that that's false. Now, the good news is that there has been a 30% drop, 33% actually drop since 1991 in cancer mortality, which means we are gaining in terms of our success in the battle against cancer. Most of this actually comes from prevention, reductions in smoking, lifestyle improvement, and screening in those areas. Once you get advanced cancer, the treatment components are also evolving very quickly, but they are spotty in terms of their overall effect, and depends really on the specific cancers and what you're getting. But things that used to be a death sentence no longer should be thought of that way. And so we should think right from the very beginning, how do I manage this as a chronic problem?
Something else you mentioned, Wayne, and it just really struck me, even just the visual of it. You said the entire cancer industry descends on the person and their family, and I'm sure it does feel like that, like the sun, moon, and stars have all fallen on you. One of my brothers-in-law passed away within the last year, 51 years old, of acute myelogenous leukemia, and he was taken great care of, but unfortunately lost that battle. And one of the things that I remember standing out to my brother-in-law and sister-in-law was when they were making appointments for visits and for treatments, they weren't necessarily consulted on when would be a convenient time. It was the appointments were just made for them. And, probably rightly so. The assumption is there's nothing more important going on in your life than this right now. But it just sort of emphasizes the point that we don't always approach cancer care with the patient-centeredness and whole person approach that we might.
Now, that's absolutely right. And what matters varies depending upon the circumstances of the patient, their age, and other things. I mean, there's unfortunately a growing incidence of many cancers in younger people, and that can completely disrupt their work life, their family life. Even if they're going to live with it. I mean, people with breast cancer are living longer, but unfortunately, it's also getting younger. And so young people with cancer need to have things right at the beginning around occupational, around fertility, around energy, around family care being addressed right at the beginning. Older people with cancer may not actually have length of life as the most important goal that they have. They may want to have quality of life and spending some certain special times with family and friends to enhance their own quality. So they may not want to spend the last few months of life, even if it'll prolong it, if they're not feeling well. And so this personalization, person-centered care, what matters to you now is a key question that all people diagnosed with cancer should be asked right at the beginning.
Yeah, that makes total sense. I think if we just take a step back and consider it, but we don't always take the time to do that. I want to bring up here at the outset a reference that I know is important, and that's the Healing Works Foundation published Healing and Cancer, A Guide to Whole Person Cancer Care in April of 2024. That was of course, written by you, along with Dr. Alyssa McManaman. What kinds of tools and resources are included in that guidebook that folks might find helpful?
We wrote this book as well as are doing a number of other efforts in this initiative out of Healing Works, really to kind of pull it all together. And the book is targeted towards care teams. And so this is really a how-to guidebook, if you will, for care teams to do this, because it is possible to do it and it's possible to improve what you're already doing in this area. We divided the book into 3 sections. One was an introduction, which describes the growing science that supports this. We now know, for example, that the biology of cancer is not just about a rogue cell, but it is about the cell and the environment in which it lives. It's actually called the tumor microenvironment. There's a whole description of the biological drivers of this called the hallmarks of cancer, and many of them are integrally linked with how the patient takes care of themselves and the wellness practices that they do. There's also growing evidence that when people are engaged in that, they actually do well. People that have high social support, for example, have a 25% less likelihood of dying over the next 5 years than people without social support. So asking about social support and helping them to engage in social support is key. Exercise has a huge impact on both quality of life as well as length of life. And cancer treatment disrupts things like sleep, which we know impact all areas of function and wellness. Cancer patients want this. They actually want to do it. We've commissioned a number of national surveys, as have others, that have asked, where do I get information about nutrition, about exercise, about social support, about counseling, and what are the things that I can engage in those areas? And actually, many cancer centers have these services available, but often they're not coordinated in a way to actually make them accessible. And so a lot of times it's not necessarily investing a whole lot more. It's about finding what's there and then organizing your care delivery so people can access it and encouraging them to do it along with their support givers. So the book really is an overview of that. It introduces the science and the data. It goes into the journey of cancer from first diagnosis through treatment to survivorship or end of life, if that's the situation. And then the third section of the book is really about implementation. How do you do this? And there are tools described in there, and we have them available online also, specifically for care team members to begin to do this, tomorrow if they want to. Also practices, systems of practices, and how they can embed that into their practice improvement processes so that it can become part of their routine culture of care delivery. So the book is organized in that way. There's a guide that goes along with it, a study guide, so you can pick it up and have your teams begin to use it.
So this isn't just for oncologists. This isn't even just for physicians. It sounds like it's germane and relevant to everybody on our care team, whether that's APP partners, nursing. It sounds like it could be applicable to anybody. Is that right?
That is correct. And in fact, if you look at who's taking care of the person, their other chronic illnesses, their health and wellness components, very often it's the primary care areas, APPs and primary care physicians and others that are the ones doing this. And so this is a guide for those individuals also to improve the care for the patients that they have coming in that have been diagnosed with cancer.
I'm always interested to learn more about the different factors that can either favorably or unfavorably, but at least potentially have an effect on survivability. And you mentioned a few things, including the social support, exercise. I heard you mention, just briefly say the word nutrition. Anything new in the world of nutrition and its value relative to cancer treatment, especially in the field of whole person or person-centered care?
Yeah, absolutely. I mean, that's one of the main questions. In fact, in our surveys, it was the number one thing that patients wanted to know about. They wanted to know about what should I eat, and how do I stay, healthy in that regard. There are growing amounts of evidence in this area demonstrating, for example, in the tumor environment, that it is significantly influenced by the microbiome, the gut. We now know there's an integral link between what's in the gut and how well your immune system functions. And as many of our listeners know, the immune system is key for managing of cancer. In fact, there are now breakthrough treatments that specifically manipulate the immune system that have become the primary leads for many cancers in its treatment. Rather than just killing the cancer cell, it's getting the immune system to actually do its job in both surveying and getting rid of the cancer. And the microbiome and the inflammatory and metabolic components, all of which are influenced by lifestyle and behavior, have an integral role in that.
And certainly that can change throughout the course of the disease based on treatment therapy. I mean, a lot of people think about, nausea, vomiting, stomach upset, decreased appetite as a result of chemotherapy, right? So that may change what you're able to eat.
What's interesting is that most oncologists think, oh, well, patients aren't interested in this. But the surveys that we and others have done have shown that they are very interested in it. And many oncologists say, well, first, let's get the treatment plan together before we discuss that. We led a group of 13 different centers from around the country over 2 years, looking at these various factors, exploring the tools, and developing resources specifically for whole person care in patients with cancer and people with cancer. And what we found is that, yes, right at the beginning, after the diagnosis, you need to get the plan going for how we're going to treat this cancer. But very soon after that, within a few weeks of getting that established, it's important to sit down with patients and talk about how they can get engaged in their own care. And we do this with something called the personal health inventory and what we call a HOPE, or a healing oriented practice and visit. And patients really appreciated this. Many of the people in the leadership group did this and found that it was very enjoyable. Patients loved it. They got to know their patients, and it actually gave literally hope to their patients that they could actually participate in better managing their cancer. By engaging in these types of things. And they didn't want to wait until they started getting side effects. They wanted to anticipate it. So right after the initial plan is developed, a conversation about that should be had.
Wayne, I've had this exact conversation with many of my own primary care patients over the years, and as I think about it, traditional cancer care is surgery, it's chemotherapy, it's radiation, it's things we do to our patients. It's not actively engaging them, and that can, I'm sure, lead to a feeling of helplessness and it's out of my control. And yet there are things that our patients and families can do that are within their control that may be helpful in the short run and in the long run for helping them battle this disease. And so talking about exercise and nutrition and all the things that we've just mentioned plus more can give our patients a little bit of sense of some control. Have you seen and heard the same?
Yeah, absolutely. And they love to have those conversations at the right time. They want to have those conversations, and their caregivers do too. And another reason that it's important to have those conversations is that if you don't have those conversations, or if you say it doesn't matter, then they will go out and find something, right? Many patients will actually go out, they'll consult the internet, they'll talk with their friends and colleagues, and they can get led down the wrong path. They can end up saying, well, I don't need this evidence-based treatment. I'm just going to go over here and do this to manage my cancer. So you have to have those conversations to prevent poor care. There are now a growing number of evidence-based guidelines that have come out, and our foundation funded several of those, looking at what is helpful out of the integrative and palliative care areas or the supportive care areas. And 3 of those have come out in the last 3 years. One for pain and pain management, one on depression and anxiety, one on fatigue. And they've shown that there's good evidence now for mind-body practices and mind-body interventions, acupuncture for pain, for example, massage and other things across the spectrum. And by getting patients involved in this early on, they can feel better and do better. Exercise, we've mentioned, should be standard of care discussion for everybody with cancer. It not only helps with fatigue, it can assist people in completing therapy. And there's some evidence, growing evidence, that people will live longer too. So both quality and quantity of life can improve by having people engaged in these kinds of practices early on.
Yeah, that's great. Thanks, Wayne. I think people have the misconception that when it comes to cancer care, they have to make a decision about traditional cancer care and untraditional cancer care. And those two things aren't necessarily mutually exclusive and may actually be more effective at treating the whole person in the long run to integrate them together. I heard you mention something that I want to go back to just briefly, if we could. You mentioned different phases of a patient's cancer journey, from diagnosis to treatment to survivorship. Could you describe for us what those phases might look like and why having different approaches or resources for each of those stages might be necessary?
Yes, I mean, interesting in cancer for most people, not everybody, but for the vast majority of people, those stages are pretty standard. And they have to do with the early diagnosis from the discovery of the cancer itself, in which the shock, the psychosocial component, the management and navigation of the medical care system becomes key. The involvement of the caregivers, the involvement of special things like fertility and employment, as I talked about before, become important at that beginning. Then during treatment, often it's about the mitigation and management of side effects. Because some of these treatments, including the immuno-oncology ones we have, can produce some pretty significant side effects, including financial toxicity, since not everything is always covered. So addressing those kinds of things and looking at the guidelines and using good evidence is important in there. The third stage is either then the resolution of the cancer, in which case you go into survivorship, or not resolution of it, in which case it involves end of life. This final stage or fourth stage, and by the way, these can repeat. So for many people, more people are getting diagnosed with a recurrent or multiple cancers, so the recycling of those stages. But in survivorship, which is not done very well in this country, after the person treats the cancer, they sort of leave. And other than going back and getting screened periodically, they don't have the rest of their chronic disease issues managed very well. And this is where primary care people come in, especially important. In fact, there are examples of models of survivorship that are now survivorship and wellness that involve, addressing symptom management. Close to 60% of people after treatment have residual symptoms that need to be managed. So just because you stop treatment doesn't mean you don't need some things to continue to build your health. And then, of course, at end of life, we have hospice care, which is there to support the well-being, even the fact that you can't cure a person. Many non-drug approaches can be very useful during that time, as well as palliative care, obviously, in those areas. So those cycles, and in the midsection of the book, we take each of those phases of the cancer journey and talk about what's useful, what does the science show, and how do you implement the various components that are useful for each of those phases.
So, Wayne, in our prior episode about the more general aspects of whole person care, we talked about barriers to adopting a whole person care, person-centered model. One of the things I wanted to ask you about with oncology specifically is the sustainability aspect of whole person care in oncology. Could you speak about that?
Yeah, that's very important. It's probably one of the most asked questions, and it often comes down to somebody saying, "Well, how do I get these services paid for?" And what's interesting, when we did our leadership group and they looked at the sustainability question and they were implementing various models of whole person care, and we did some case studies on these, we found that actually wasn't the most important question, even though people asked it. For example, surveys have shown that a majority of health systems have some aspect of whole person care already available. And it's a matter of simply organizing things. They're already being paid for within the system and organizing them to do this. What we found is that the most important thing was leadership and beginning to organize the delivery system to access those and then find services within the community in many cases that you could link people up to. And there's several case studies on our website that describe how to do this. It really was about prioritization and a culture change. Now, that being said, you do need to have your business team involved in the process because coding and payment are important. And we have a coding guide on our website, but others have talked about that. What's happening very frequently is that there are ways to make this sustainable, but the practitioners aren't familiar with them. So you have to get your business folks involved so that they know how to code for this. There's examples out there. CMS has something called the enhanced oncology model, which will pay for many of these services. There's codes for supporting social determinants of health, and there's examples of how to pay for group visits, health coaching, and that type of thing to support these areas. And so it is possible to have sustainable models of this. If it's organized, you get your business folks involved. But the way to do that is first get the leadership engaged so it becomes a practice improvement project and becomes established as part of your culture.
Wayne, what haven't I asked you, or anything else that's essential for our listeners to know right now when it comes to whole person care in oncology?
Often when you say, well, whole person care is important, I've seen the science of it, I've seen the need for it, I've seen the benefits of it, I've seen the demand for it. Often clinicians say, God, not another thing I have to do. Okay, I'm already overwhelmed in these areas. And what we recommend is that it's actually relatively simple to start this process. And we talk about this in the book, we talk about it on our website, and we provide some tools that make it easier. Our goal here is to make it simple in those areas. And I'll point to one for your listeners. It's called the Personal Health Inventory, or PHI. It's a very simple 2-page questionnaire. My patients fill it out sitting in the waiting room. It takes them 5 to 10 minutes. And the purpose of it is to have that conversation about health and wellness and whole person care. It starts with the question of what's important to you in life. Why do you get up in the morning? What's joyful? And then you have that discussion, and then you work at aligning the self-care, integrative, and person-centered components along with that. There's an electronic version also, so you can just send it to patients. They can fill it out. You can do your notes in it. You can bring it into the electronic medical record. Go to our website, download the PHI, or the Personal Health Inventory, and then try it out. Try it out with a few patients. If they like it, then bring it to their team and have a discussion about it.
Fantastic. Every patient deserves care that is individualized and personalized. So thank you, Dr. Jonas, for sharing your expertise with us today. I've really enjoyed our conversation. Dr. Wayne Jonas from the Healing Works Foundation has been our guest on the podcast today. Listeners can find all the resources mentioned in our discussion linked in the episode description. Until next time, stay well.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.